Hey everyone, this is Dr. Boyd. Welcome back to Parently. I want you to click the link below and come see us. We want to be your labor coach. We can help you successfully navigate through labor and successfully have a vaginal delivery that you're happy about. That's the key word. We want you to have a successful vaginal delivery, and beyond that, we want you to be happy about your situation. Now, today we're going to talk about when the baby is in the position other than head down. Now, medically, when the baby's head down, we call that vertex. We want the baby to be vertex. And 98.5% of babies are vertex. That's a large percentage. Why are babies vertex? Why are they cephalic? Why are they head down? 98.5% of all babies are in that position by the time they go into labor. Why? That is the smallest part of the head, and that head can push on the cervix and help dilate it. So the babies, most of the time, come down like this. They come down with their chin against their chest, and that part of their head is the smallest part of their head, and that gives the baby the greatest chance for success for delivering vaginally. But there's a small percentage of babies that are in the abnormal position. They're either sideways, we call that transverse, or they're upside down with their feet down or their butt down, we call that breech, or they're sitting a little bit sideways in the pelvis, we call that oblique. Now, what do you do as a patient if your baby is in the abnormal position? Well, most providers take you right to cesarean section. They allow you to go to 39 weeks, and then they take you to cesarean section. Now, why do they take you to cesarean section before 40 weeks? If you rupture your membranes and you have a baby that's in the breech presentation or the transverse presentation, you run the risk for what's called an umbilical cord prolapse. That's because there's nothing preventing things from falling down. So when you rupture your membranes and your head down, the umbilical cord can't get through the cervix because the baby's head is there. So there's not a large percentage of women that have cord prolapse. But when the baby is in the breech presentation or the transverse presentation, potentially that cord can fall down through the cervix, and that's called a cord prolapse. So most healthcare providers want to take you to cesarean section at around your 39th week to prevent the risk for cord prolapse. Now, let's talk about the patient that is in the breech presentation, butt down, and doesn't want a cesarean section. What options do you have? Well, there's a great option called a external cephalic version. That's a medical terminology that simply means we're going to rotate your baby from the breech presentation to the head down presentation. Healthcare providers, specifically obstetricians, can do external cephalic versions if they feel comfortable with it. In my practice, I feel comfortable with external cephalic versions. I've done them many times in my career. The success rate's about 50%. So you as a patient have to understand that just because I'm going to attempt to flip the baby doesn't mean that I can. So your breech, the baby's butt down, not feet down, because if your feet down, if the baby's feet down, we can't do a successful cephalic version. Now again, external cephalic version can also be discussed in the transverse presentation, but most babies that we're talking about cephalic versions, we're talking about butt down breech. So what happens in that scenario? First of all, you have to understand, you have to talk to your healthcare provider and see if they're comfortable. If they're not comfortable doing that, can you look in your local area and see if there's somebody that does this or can attempt this? What's the process? You come to the hospital. We typically do this in the operating room. We do it under spinal anesthesia because it's very, very painful, with the understanding that if there's any problems with the baby, we immediately proceed with cesarean section. So you come to the operating room, spinal anesthesia, you're laying in a position. We do this under ultrasound guidance. We slather your belly with oil so it makes it real slick, and we try to rotate the baby from the butt down breech presentation to the head down presentation. Success rate, as I mentioned, is around 50%. If you're successful and rotating the baby, and you're 39 weeks, your healthcare provider may keep you at that point and just induce you. I did my cephalic versions around 36 or 37 weeks. And the reason I did that is because the baby's a little bit smaller, there's still adequate amniotic fluid, and we had a better success rate of flipping the baby. Think about trying to do a flip in 2 inches of water versus doing a flip in 1 foot of water. I'm talking about as a little person. It's a lot easier when you have more water. And you have more water at around 36 or 37 weeks, the baby's a bit smaller, so the success rate's higher. So in that scenario, obviously I'm not going to induce you because you're less than the 39-week mark. But if we're successful, most of the time the babies will stay that way. When I say most of the time, well over 90% of babies will stay head down if you get them flipped to head down. So, external cephalic version. I encourage you to look into this if your baby is Frank Breech presentation. That's butt down position. Also, if the baby is transverse, that baby potentially can be flipped to the head down position. But you've got to talk to your healthcare provider and see if they're comfortable doing that. If they're not, look locally. This is a small percentage of women that can undergo this procedure, but if you're one of those, this is a great opportunity for you. We want to be your labor coach. It's little things like this that are important for you to understand of why a successful vaginal delivery occurs. If the baby is not in this position, it has a greater chance for failure. And so it's important to understand why the baby's in that position. I hope this was helpful. Have a great day.